Hi, y'all. Still waiting for Rashi to get in here. Thank you for your patience. I've got a starting soon graphic up.
Is this on 26 Live, or is it?
It will be.
Okay.
Yeah.
But not at 2 p.m.
Well, it was supposed to be, but
Okay, got it.
I'm delaying start a little bit.
Okay, thanks.
Welcome, Rashi. Are you all ready to start? Rashi, we don't hear you.
Can you hear me?
Yes.
Okay, wonderful. So we're going to go ahead and start. Thank you so much. And we're going to be talking about COVID-19 and how it relates to children, because now those who are 12 and up can get the vaccination. So I was just going to start off by asking you what you think about the recommendation and if you recommend it to your parents, to your patients, excuse me.
Well, I do see patients. Yes, I do recommend vaccination, certainly under the current recommendations, which are ages 12 and up. I think the data are very solid, that the vaccines that we have authorized in the US are incredibly effective, and that they are making a huge difference in terms of how the pandemic is evolving. That being said, there are still groups of folks, including parents of children in that age group, that have concerns or are hesitant to be vaccinated. And I think it's important to not treat all of these folks in the same way, because there are many different reasons why they might be hesitant, and you need to really pare down and see what those reasons might be, and maybe we can discuss what some of those reasons might be. But the approach that I would use would vary depending on what I think is driving their hesitancy or reluctance. But overall, yes, I strongly recommend the vaccine under the current CDC and FDA authorization for ages 12 and up. And as the data for younger groups becomes more available and safety and efficacy is demonstrated in those younger groups, then I will support that as well, lowering the age group.
And what are some of those concerns that you hear from Dr. Jetelina? I'll ask you this. What are some of the concerns that you hear from parents?
Yeah, they range, but typically, there's some major themes that we're seeing pop up. And they're themes that also represent the adult population on hesitancy, right? People are worried that the vaccine was rushed. People are worried about actually their kids, their adolescents experiencing side effects. Fevers and chills or diarrhea is just not fun for kids. Among adolescents specifically, there's a concern that there isn't a need, so a lot of parents just think, hey, a lot of kids may not get this. They don't necessarily die from it as much as parents, so maybe there's not even a need, while there really is quite a need. And then other, concerns like the mRNA not changing the DNA is something we have to address a lot. Long-term side effects comes up a lot, like infertility, and us explaining how that's very unlikely. And then another theme is, why do I need it, or why does my kid need it if we've previously recovered from COVID already? And so those are kind of the major ones that we find that we're constantly addressing.
And what is your directive to the parents when they bring up these concerns, since they are, valid?
They are valid. And I think it's important to keep that in mind, to show some empathy, to have a two-way communication straight, and then also to hear their concerns and listen, and then also provide them with evidence that's grounded in science if they do have concerns about specific issues.
Okay. And I was going to ask this other question because several people right now are asking where to take their kids to get the vaccine.
Well, there are a multiplicity of venues, everywhere from your local pharmacy to your county health department. There's been a push in recent weeks to get away from the mass vaccination centers and trying to push the vaccine sites out to smaller locations, but that are more accessible by neighborhood or even rural areas, things like mobile clinics, et cetera. There are a number of phone numbers available in your locality that will tell you which sites are available. Again, they're going to be applying CDC guidelines, so they will be offering vaccine to those 12 and above. There is right now more vaccine. There's ample supply of vaccines, so even same-day vaccinations are possible. I would encourage just getting on the web and saying, where can I get vaccinated? Where can my child get vaccinated locally? And you'll see that a number of phone numbers and locations pop up. It's very easy.
And I was going to ask you too, when it comes to school starting, many people taking summer school, many students, and then there's also teachers out there. So do you recommend that teachers also get vaccinated as well?
I recommend that anybody who's eligible get vaccinated. The benefits are, the benefits overwhelmingly outweigh any potential small risks. Benefits both from a health standpoint as well as from a freedom standpoint, an ability to do a lot more things and to enable society to reopen is hinging tremendously on getting enough folks fully vaccinated so that some of these loosening of these restrictions can be possible.
As far as children 12 and under getting their vaccine, do either of you have any indication as to when that might happen?
Yeah, so yesterday we found out from Pfizer that phase 1 was successful with kiddos age 5 to 11. And so what that means is that and I've heard this multiple times, we're in the final frontier with vaccines, and that those kiddos should probably have a vaccine in late fall. It doesn't look like they're going to be getting it before school starts in fall.
Right, to which I would add that there's also been encouraging, we'll see if it happens, but maybe even younger age groups, maybe even as young as 6 months before the end of the year. And that's about as low as they're going to go, which is about, the age group of 6 months is also the age that we start recommending flu vaccines in kids. So the research is advancing very quickly, but very safely. And so we may well have, at least authorization before the end of the year for all age groups from 6 months upward.
Okay. One concern that some people have is, well, there was emergency use authorization for this vaccine versus FDA approval. So what is the difference between the two? And I did do a story on sort of the criteria and how just because it wasn't approved by the FDA, that approval doesn't necessarily mean that it's not safe. It's not as safe. So could either of you explain the difference between the two?
Yeah, so there's actually not too much difference. So going through emergency authorization, it goes through the same loops as fully approved. The difference is with emergency use authorization, there has to be an emergency, like a global pandemic, and then there has to be at least 2 months of follow-up data for these patients. For full approval, like we're already seeing with Pfizer and Moderna, that they're submitting to, they need at least 6 months of follow-up data. And that's really the key difference between authorization and approval.
And I think that's so important for people to understand, because they hear that it's not FDA approved and automatically think it probably is not safe, which is something you all probably hear as well.
We do, and I think the important message that Katelyn's also bringing up is nothing was sacrificed in terms of the research regarding safety and efficacy of the vaccines in order to get emergency use authorization. It is true that the follow-up period was extended between emergency use authorization and full approval from 2 to 6 months. But by and large, if there are any long-term effects associated with the vaccine, which, by the way, none have been demonstrated yet, about 95% of those, if they were to occur, would occur typically in the first 2 months. That's why they have that cutoff of 2 months for emergency use authorization.
Okay. And thank you all for joining on Facebook. We have a lot of viewers, some of them saying naysayers are starting to comment saying that they're very concerned about those who are not tested. How concerned should they be being around people who might not have been tested?
So, not sure about the question intent. I think the testing is very easy, still very easily available to anyone who has symptoms of COVID. I would certainly urge people who have not been fully vaccinated to get tested if they have been exposed or if they think they have symptoms of COVID. It's so easy to get this testing. There's even available. I was in my local Walgreens the other day, and you can get rapid testing off the shelf now for about $23 a test. And even for people that are fully vaccinated, although it is highly unlikely that if you're fully vaccinated, you can get COVID, it's not entirely impossible, although at least in our data, the risk is less than 0.5% of those who are fully vaccinated getting COVID. But if you think you can still avail yourself of these tests just to be sure. The other scenario where people are likely to be testing as we open up to international travel, more and more countries are requiring testing before you travel. So you need to know where it's available. Your county health department, your local pharmacies, possibly even your doctor's offices now all offer testing.
All right. And as far as gatherings, because we know that there's going to be, well, July 4th coming up. A lot of people are going to be gathering possibly then because, just to celebrate. Do you still recommend any restrictions either way, like doing something outside versus indoors, or how many people you should be around?
Yeah, so with events, we're not at that amazing number threshold vaccinated. About 50% of us in Texans are just don't even have a vaccine yet. And so, we still have to be vigilant, especially even if you're vaccinated, if you have unvaccinated kids like myself. If you have kids, you want to have them wear some masks, especially in large crowds and when they're stationary. You want to stay outside if you can, and even socially distance at least 3 feet. 6 feet is amazing, but yeah, all of the precautions we have been hammering the past 14 months still apply among the unvaccinated.
And I would add that it's very important for people to use common sense and know the audience that you're going to be with. Know a little bit about them. If you know that everybody is fully vaccinated, it's safe to be around them, especially if you are as well. But even if you're unvaccinated and everybody around you is fully vaccinated, the risk of you acquiring COVID is low. If you're going to have a gathering with people who represent a combination of vaccinated, unvaccinated, and they are known to you, then you should wear a mask around them. Know your audience. Just because somebody's a family member, if you haven't seen Uncle Fred in 6 months, that doesn't mean that just because they're family that you know everything about them and where they've been. The larger the gathering, the less you know about the vaccination status of that group that you are around, the more you should avoid lowering your guard and err on the side of precaution and continue masking and some of the measures that Katelyn was mentioning.
Yeah, we got invited to a big Indian wedding, and it's like 500, 600 people. And part of the invitation online was you had to say if you were vaccinated or not. So I feel like that's starting to become, the norm, which is a good thing. So, what's, we're not going to take our kids or anything, but, that situation is happening. So we know that kids are less likely to get COVID, but what about some of the future variants? And could the vaccine protect them?
Yeah, so all of the vaccines protect against variants right now, which is fantastic news. They're a little less effective, but they still work against severe COVID. All eyes right now are on Delta, as I'm sure everyone's kind of heard in the past couple of days, because it seems to be more transmissible. And so the levels of COVID are a lot higher among the younger population. So hospitalizations among younger populations are increasing. What we still need to learn and know is that because they're just not vaccinated in the UK, or is that because this variant has changed and the disease is becoming more severe for the younger populations, and the jury is still out. We're not entirely sure yet.
All right. Is there anything else you both would like to add?
Mainly to reiterate, that people have different reasons for being reluctant to get vaccinated. I do think only a minority, a very small minority of them, are due to longstanding beliefs against being vaccinated. The majority of folks who are hesitant are because of some of the reasons that were mentioned before. People may think that the research isn't there yet, or they may have other reasons, and you have to individualize the approach. Especially if you're a provider. If you're a primary care provider, survey after survey has shown that people tend to trust what their doctor or primary care provider, the type of advice that they propose, even more so than the CDC. And I've had several patients that I've talked to that I've known for a long time that come in reluctant, and by the time they leave the office and I've spoken with them, they're convinced to get vaccinated. So for those primary care providers out there, please don't underestimate your role. It is very powerful. The message is, my message to everyone is, please get vaccinated. The benefits greatly outweigh any potential small risk.
All right. Well, thank you so much. I appreciate both of your time, and sorry we ran a little bit late, but I think this is valuable information, and hopefully everybody is able to be safe and go. I don't want to say get vaccinated because I'm going to get in trouble, but go by what you say. There we go. I attributed it. All right. Thank you.
Thanks for having us.
Thank you very much. Have a great one.